Yum! Delilah, have some?
Okay. Getting her daughter to eat is a test of patience for Chloe Kirbisher.
A little bit.
2-year-old Delilah usually spits everything out.
You want to try it?
Ever since she was born, Delilah has avoided eating solid food.
She doesn't particularly eat any food, like as you saw. The only food that I would say she eats a little bit of is cheese. And I mean, you can see how much is in that bowl that I offer her, and that doesn't even get eaten in a day.
Chloe has tried everything. While other toddlers her age are long used to eating normal meals, Delilah will only drink from the bottle. Her mother suspects an eating disorder linked to autism, but she's not sure. The family doctors haven't been able to help, and Chloe's been waiting 6 months for an appointment with a specialist.
Every single doctor, professional that I've seen, they're all like, yeah, I've never come across a case like this, so, you know, they don't really know what to do. Well, then it's not normal, is it? So then I should be seen by a specialist within a certain amount of time, because if none of them have come across it, clearly it's that unique or it's that out there that it's not just going to resolve itself.
Over 6 million British patients have been waiting months or even years for an appointment with a specialist. For years, the former Conservative government spent less on the healthcare system than comparable European countries. That was one of the big issues in the election at the beginning of July this year. Andrew Meyerson is an emergency doctor. He says the situation in many hospitals reached breaking point long ago.
So emergency care is awful for clinicians, for patients. We're seeing patients that have to sit in our waiting rooms, that have to sit in the corridors waiting for care. People that are dying on the backs of ambulances waiting to be brought into A&E, dying inside our A&E departments. I fortunately work at quite a good hospital where we don't see a lot of that, but just knowing that exists in so many different places, in so many different hospitals across this country is just, it's devastating.
Doctors and nurses are leaving. Around 100,000 posts in England are unfilled. The professionals are attracted to careers abroad with better pay and working conditions. Many of those who stay can't cope with the pressure and suffer physically and mentally.
We're seeing record numbers of our colleagues having mental health crises, taking time off of work because of mental health crises. I've been to the memorial services of colleagues who have killed themselves because their work is just far too difficult. And they took too much of that home. And that's awful to deal with.
What do we want?
Doctors and nurses go on strike due to poor working conditions, which then leads to even worse patient care. The new Labour government has promised more money, shorter waiting times, and new staff for the healthcare sector. That's urgently needed, says Meyerson.
We need to fill the hole that was left by the last government. We need more hospital beds within the NHS. We lost 25,000 in the last decade. We need to stop the staff hemorrhage. We need to stop losing 20,000 doctors every year, 40,000 nurses. And we need to solve the social care crisis, because if we can't get patients out of hospital, we're wasting billions there. And then we're providing terrible care.
You've got to tell him, Mum.
Chloe Kirbisher agrees. There's no way things can stay as they are. Wow. She's worried about her daughter's future.
Go on the floor.
A 2-year waiting list for a child is just wrong. It's not like it's a routine appointment, like, oh, you know, it's just this, it's that. It's a serious thing. What, she's going to be 5? What, she's going to be bullied in school because she can only have formula?
Run!
So far, all her mother's efforts to shorten this long wait have been in vain.